Hello and welcome to your whiteboard walkthrough. Psych! It's a regular lecture. It's not a whiteboard walkthrough. It's all on PowerPoint. Let's go! So to start off, we are going to break down the lumbosacral plexus into two separate plexi, the lumbar plexus and the sacral plexus. Named for where the nerves are arising from, the lumbar spine for the lumbar plexus and the sacrum for the sacral plexus. The lumbar plexus is made up of anterior rami, just like the brachial plexus, from levels L1, L2, L3, and L4. Yes, there is a fifth lumbar nerve. However, it is not a part of the lumbar plexus, but is actually a part of the sacral plexus. This is also the reason the plexi are sometimes grouped together as the lumbosacral plexus, since they share some overlap. The sacral plexus is made up of anterior rami from levels LST, which I'll explain in a second, S1, S2, S3, and S4. LST stands for lumbosacral trunk and is actually the combination of L4 and L5, which form into one contribution to the sacral plexus. Let's attack the lumbar plexus first, and specifically focus on the important and applicable branches to the lower limb. Most of this plexus actually exists in the posterior abdominal wall, then some of these nerves leave the posterior abdominal region to enter into the lower limb. These are the ones we will focus on. Femoral nerve and obturator nerve both originate from the lumbar plexus. Specifically, these nerves are both made up of levels L2, L3, and L4, which is very convenient for us. They do, however, innervate different areas, even though they are comprised of the same anterior spinal rami levels. Femoral nerve innervates the anterior thigh compartment, meaning it innervates the muscles and skin in the anterior thigh region. If we take that information one step further, we can start to associate femoral nerve with actions as well. The anterior thigh is made up of flexors of the thigh at the hip and extenders of the leg at the knee. So you can see those actions here. Flexion of the thigh at the hip is moving your thigh anteriorly in space, bringing it towards your abdomen and chest, whereas leg extension from this flexed thigh position at the knee is the movement of straightening out my leg. Here you can see I flex my leg at the knee from anatomical position and extend to straighten it, like kicking a soccer ball. Obturator nerve innervates the medial thigh region, which is made up of mostly adductors of the thigh at the hip. There are some muscles with other functions, but the majority are adductors. Here you can see me perform adduction of the thigh at the hip. I have to abduct first to show you adduction, which is the action of bringing your thigh from a lateral position to a more medial position that is closer to midline. Adduction, add it back to the midline of your body. There is one more nerve from this plexus that is related to the lower limb, and that is the lateral cutaneous nerve of the thigh. It's comprised of levels L2 and L3 and provides innervation from the skin of the lateral thigh. Sometimes when people wear tight belts, they can actually compress this nerve and cause numbness and tingling in their lateral thigh. Other than that, it's pretty insignificant. Rest of the lumbar plexus is not a part of the lower limb, but more a part of the posterior abdominal region. I'm going to show you those branches anyway, but remember, they are not applicable to the lower limb, so while possible, it is very unlikely that they would show up on a lower limb exam. L1 gives off two branches, the iliohypogastric and the ilioinguinal nerve. Then L1 and L2 combine into a nerve called genitofemoral nerve. The genitofemoral nerve branches into a genital branch and a femoral branch. And that's pretty much all I'm going to say about that, since you're going to revisit these later when you're in a different unit. Okay, moving on to the sacral plexus. The sacral plexus is a little more applicable to the lower limb and a little more complicated. So let's run through the branches that it gives off, then connect them to their anterior rami levels. So we have superior gluteal, nerve to quadratus femoris, you'll see why I grouped them this way soon, inferior gluteal, nerve to obturator internus, nerve to piriformis, the sciatic nerve, which is really tibial nerve and common fibular nerve running together in a sheath through the gluteal region, posterior cutaneous nerve of the thigh, and pudendal nerve. Superior gluteal nerve and the nerve to quadratus femoris are actually made up of the same levels, L4, L5, and S1, the first three levels. If we think of superior gluteal being grouped with nerve to quadratus femoris, and we think of inferior gluteal being grouped with nerve to obturator internus, you'll notice that the superior gluteal group is made up of levels one step higher or more superior than that of the inferior group. inferior gluteal nerve and nerve to obturator internus, you can just shift down one level for the makeup. These nerves are made up of levels L5, S1, and S2. Grouping and organizing is fantastic for this plexus because it helps make it less complicated and easier to remember. For nerve to piriformis, you drop the L5 from the inferior group. So nerve to piriformis is made up of S1 and S2. The muscle belly of the piriformis muscle sits on the sacrum internally in the pelvis, where all these nerves are arising. So S1 and S2 are actually very close to this muscle belly. Sciatic nerve is made up of almost all the levels, all but the last one. So sciatic nerve is comprised of L4 through S3. Some sources will say differently, but I get all my information concerning levels from Moore's Clinically Oriented Anatomy. If your course or lecture uses different levels, make sure you adjust them to your lecture. That is the material you will actually be tested on. These levels are very variable and are very much dependent on the individual's anatomy or development. So we report an average, essentially, when we talk about composition of nerves. Sciatic will then branch into the tibial and common fibular in the posterior thigh, but we don't care which levels comprise those nerves. That's too much. Posterior cutaneous nerve of the thigh is comprised of S2 and S3 and will provide some posterior gluteal and thigh skin with innervation. And lastly, pudendal nerve is comprised of S2, S3, and S4. S2, S3, S4 put the poop on the floor, picks the penis up off the floor or clitoris, although those typically don't drag on the floor. Anyway, pudendal nerve will innervate your perineum, which is a space just inferior to the pelvis. To understand the sacral plexus and apply it to the lower limb, you first need to understand the pelvis and the gateways that exist there. There are two ligaments I want to focus on that create two of these major gateways from the pelvis to the gluteal region and the perineum. The first being the sacrotuberous ligament, which you should have seen in your gluteal dissection. It runs, as the name suggests, from the sacrum to the ischial tuberosity. The second is the sacrospinous ligament, which is deep to the sacrotuberous ligament in the gluteal region, closer to the pelvic cavity, and runs from the sacrum and coccyx to the ischial spine. These two ligaments crisscross to form two gateways, which we call foramen, the greater sciatic foramen and the lesser sciatic foramen. The greater sciatic foramen is formed inferiorly by the upper border of these two ligaments, and then the greater sciatic notch superiorly, which is an inferior aspect of the ilium. The lesser sciatic foramen is the space found between the two ligaments and is bounded by the lesser sciatic notch, which is just a notch just inferior to the ischial spine. The only other foramen that matters in terms of nerves traveling to the lower limb is going to be the obturator foramen, which can be visualized better in other lateral images, but is the hole between the pubis and the ischium anteriorly. But why do we care about these foramen? We care because the things from the pelvis end up in other regions by traversing through these sciatic foramen. So we care because pelvic fractures or any sort of damage to the integrity of this bone can cause damage to many lower limb structures because of these gateways. So let's see what goes through them. The piriformis muscle originates on the internal posterior pelvis on the sacrum and then travels through the greater sciatic foramen to enter the gluteal region and attach to the femur. The superior gluteal nerve, inferior gluteal nerve, and sciatic nerve all enter or begin in the pelvis and travel through the greater to be found in the gluteal region. The superior gluteal nerve and artery can be found superior to the piriformis in the gluteal region. This is why I call the piriformis the key to naming structures in the butt, because nerves and arteries above it, superior to it, are always superior gluteal nerves, whereas nerves and arteries that come out below it are inferior gluteal nerves and arteries if they stay in the gluteal region. The sciatic nerve is also coming out inferior to the piriformis, but it is so large it cannot be confused with the inferior gluteal nerve, nor does it stay in the gluteal region. The pudendal nerve and associated artery leave the pelvis through the greater sciatic foramen, but then reverse by heading through the lesser sciatic foramen to leave the gluteal region and enter the perineum in what's called the anal triangle. So it goes through both sciatic foramen, and you can actually especially see it in the gluteal region diving under, so deep to, the sacrotuberous ligament, but over or superficial to the sacrospinous ligament. The rest of the nerves we talked about from this plexus also traverse, for the most part, through the greater sciatic foramen to reach their targets in the gluteal region, except for nerve to obturator internus and the obturatus internus's muscles tendon, which exit the pelvis through the lesser sciatic foramen to get to the gluteal region and attach to the femur. Let's summarize these plexi. The lumbar plexus is made up of anterior spinal rami, branches, of levels L1 through L4. This plexus originates from the posterior abdominal wall and has branches into the pelvic cavity and into the lower limb. It gives off the iliohypogastric, ilioinguinal, and genitofemoral nerves, all of which are not applicable to the lower limb. It also gives off lateral femoral cutaneous nerve, femoral nerve, and obturator nerve, which we do need to know for this unit. Another way you could organize this information is via a chart listing everything you've learned so far. Maybe just the names of the other nerves in this plexus, but forget about the levels, the functions for now, because this will come up in other areas of your study. Lateral cutaneous nerve of the thigh from L2, L3, starting in the posterior abdominal region and heading to the anterior lateral thigh to innervate skin. Femoral nerve L2, L3, L4 from posterior abdomen to anterior thigh to innervate muscles and skin in this area. Obturator nerve from posterior abdomen into pelvis and then through obturator foramen to leave the pelvis and enter the medial thigh and provide motor and skin innervation to the medial thigh region. And of course, you can add any columns you need like function later. To summarize, the sacral plexus is comprised of anterior rami from spinal levels L4 through S4, located primarily in the pelvic cavity and heading to the gluteal and perineal regions, giving off many branches including superior and inferior gluteal, pudendal nerve, nerve to obturator internus, quadratus femoris, and piriformis, as well as sciatic nerve and posterior cutaneous nerve of the thigh. Woo! In chart form, I've detailed out their levels. What I would suggest for you is that you use this as a check for your own work. As you create a chart or drawing from scratch, you can use this chart to check and see if you missed any information. And as always, if I left anything out or your lecture states something slightly different, please follow your lecture and add the things I left out so you don't get into any sticky situations on test day. Thanks for watching, guys. Like, subscribe, share with your friends. First video done. Next video is the whiteboard walkthrough version addressing this same information. Toodaloo!